My philosophy is that when I've met with the patient, say for the first time, that at the end of that meeting, they know as much about their disease as I do. And I try to reach that point in our first meeting. In other words, we gather up the diagnostic information. Hopefully they've been worked up fairly extensively before they actually come to see the specialist. And then we run through the implications of all that. My goal is that they have a deep and broad understanding of, one, the disease process, and two, the likely treatment pathway ahead of them. Most of the time, we have another family member or members present at the discussions. The value of family members, apart from the obvious value of fellowship, moral support, the major value is it's almost like a second opinion, coming from someone who's a little removed from the emotion of having a cancer diagnosis. So that person who's a family member is sitting there, they're listening to the conversation, and they'll come back with questions to me, or they'll ask questions of the patient that I would never have thought of and the patient would never have thought of. So they're a third pair of listening ears that are critical to, should we say, fleshing out and rounding out the discussion, again, to get to that point of greater and greater understanding by the patient of what they have and what their treatments will involve.